so much, all the jurors, for your outstanding contribution and helping us decide onto the deserving winners of the Healthcare Heroes Awards. Starting with you, Dr. Sunil. We would like to understand what are the effective strategies for promoting and addressing the healthcare needs within a community in India.
I would like to thank Jagran Media for giving me an opportunity to act as a jury for this awards, which you have already seen, the award ceremony. And it was an amazing experience. The whole process for the awards, they were seamless and very transparent. And now coming back to the question, Vani, what you have asked, the strategies which we should adopt to involve the communities in healthcare. See, most important part of involvement of a community is engaging the community, educating the community, and empowering the community. So educate, engage, and empower the community. That's very important. Healthcare is something which is not at the individual level. We should always think of the community. Most important aspect of community health is the preventive health. You need to have outreach programs. You need to have screening programs for the non-communicable diseases, common diabetes, hypertension, cancer. So this is something very, very important. Preventive strategies. First thing is to adopt preventive strategies amongst the community. Educating the community through various workshops, webinars, and meetings. So that's important. Then you need to involve the local bodies, NGOs, schools. And this is also engaging the community. So health awareness and reaching out to the community, reaching out to the last mile, to the last city. What we talk about universal health coverage. What is universal health coverage? Universal health coverage is, Ayushman Bharat is the biggest example of universal health coverage. It is accessible, that healthcare should be accessible to all and it should be affordable. And of course, quality healthcare we talk of. So I think community engagement is something which is not only one man's job. We need to collaborate with various stakeholders to reach out to the community. Yeah.
I think very well answered, Dr. Sunil. Coming to you, Dr. Nimesh, you are a senior consultant in psychiatry and former director with IHPAS. So this brings me to a very important question about mental health well-being. एक बहुत बड़ा चैलेंज हो गया है सोसाइटी के लिए. How to balance your personal life, your work life, and how to cope up with the persisting pressure of social media, which we discussed also. तो ऐसे में आप क्या सजेस्ट करेंगे कि इसको ओवरकम करने के लिए, इस मेंटल हेल्थ का जो चैलेंज है इसको ओवरकम करने के लिए क्या कुछ एफर्ट्स हो सकते हैं?
Thanks to Jagran Media, thanks to my long-time friends by now, Megha and Vani and Chinmay and many others. Okay, let me start with a provocative, explosive statement. Our anchor or moderators asked me, one of the things was about social media. I think that social media is if not at least one of the social support systems for human race, certainly for youngsters. Let's stop maligning and attacking social media as being all negative. I say that with a huge lot of responsibility, but also I say that to make the major point that one major need to continue from what my friend said. Community health, community medicine, public health, whatever one might call it, public health is a much larger concept. The first need is to break stereotypes. Like we said, one, things like social media. Two, biomedicine or even community health, if I might say, is not public health. I happen to be a passionate, interested, qualified public health professional besides being a mental health guy. And so my interest goes far beyond mental health to break stereotypes. Biomedicine or even community medicine or community health is not public health. Public health will have to be much larger concept as we are beginning to understand across the globe. What are the other stereotypes? empowerment that my friend again spoke about so well. Let me take that a step further. Health empowerment of individuals in clinical practice, health empowerment of communities, of subgroups is actually very critical, and one of the blocks, among the many blocks, is from the system, the bureaucracy, the political system, including the medical systems. Empowerment of any one group or cause cannot happen without real or perceived disempowerment of some other group. Think about it in terms of gender, think about it in terms of global north or global south, wherever. So if we really want empowerment, health empowerment, medical groups, health professionals, and a whole lot of other power groups will have to learn to accept disempowerment. You see, equitable empowerment is a very difficult game. We are again heading towards it. And that's where my respect for Dainik Jagran and Only My Health channel particularly is huge and keeps on increasing. Lastly, in line with that, if there is one thing that the recent epidemic has taught us, a couple of things, if not one, I think it's these. One, health is important for development, for wellness, for human existence. Health behavior is important for health. Like I keep saying ad nauseum, and Dr. Jain Saab has possibly heard me say this earlier. Till recently, we were beginning to understand and implement that individual behavior determines individual health status. So how healthy you or I or any one of us will be at 40 or 50 or 60 or 70 plus will depend on how I behave and my lifestyle. Now we have learned that group behavior or community behavior is important for community health. So it's no longer limited to 5 of us behaving well or not well individually. All 5 of us have to behave sensibly so that our collective health remains well. 3, that human behaviors, particularly health behavior, is modifiable, mutable. That's one huge lesson we have learned. Vaccine story or a whole lot of others. And so, if you are willing to learn lessons from this epidemic besides the long-term history, the outlook for health status and health and well-being is very positive, especially depending on a whole lot of initiatives like this one.
Very well answered, Dr. Nimesh. Coming to you, Dr. Manisha Pandey, I would really like to understand, let us keep it bilingual also so that we can better connect with the audience. थोड़ा सा हिंदी में भी हम बात कर लेते हैं, कोई बात नहीं, बिल्कुल भाषा तो अपनी है, हम बिल्कुल इसको we'll try to include it in our discussion as much as possible. डॉक्टर मनीषा, जब हम बात करते हैं हेल्थ केयर लीडर्स की, तो जो पब्लिक वेलनेस इनिशिएटिव्स होते हैं या हेल्थ केयर इनिशिएटिव्स होते हैं, उसमें कितना कारगर या कितना बड़ा रोल ये जो हेल्थ केयर लीडर्स होते हैं उनका होता है टू अंडरस्टैंड, जब ग्लोबल क्राइसिस आता है, जैसे हम पैंडमिक की ही बात करेंगे, तो कितना बड़ा रोल इन हेल्थ केयर लीडर्स का आ जाता है कि सही रास्ता नेविगेट करते हुए पब्लिक पॉलिसी या इनिशिएटिव्स हम लोगों तक पहुंचाएं?
See, first of all, I would like to say I feel very happy in the present state because as the MOS was saying, I belong to that generation. I have seen 80s, 90s. So in medical field also, we have graduated from, people were dying, people were sick because of infective diseases. So we have over the years graduated to such a comfy space कि ये पुरानी वाली बीमारियां खत्म हो गई हैं. So now it is all about lifestyle diseases. So why I say this is a very happy space, because we have we know medical tourism, you keep hearing about that. So whatever you can think of in the world in terms of medical advancements, we have it here. People take opinions from abroad, but they want to be treated in India itself, and that is a very, very big achievement. But what is the lacunae? With the kind of population we have, all this is concentrated in the metros. So where are we lagging behind? We have the best of medical opportunities, treatment, and still we are labeled as a LMIC, where medical facilities, and the data says otherwise. So that is because of lack of last mile connectivity. And I think this is one area where public health leaders need to work upon. कि they will be the link. The government has brought out wonderful policies. It is, more like अभी आप कह रहे थे ना कि हमने उम्दा किस्म की मिठाइयाँ बना ली, दुकान हमारी सजी हुई है, अब भूखे को ये बताना कि तुम बूंदी खाओगे कि गुलाब जामुन खाओगे, और खाओगे तो कहाँ से खाओगे, आई थिंक दैट इज़ रिक्वायर्ड. दुकान सज गई, भूखे भी हैं, अब लाना है. सो आई थिंक पब्लिक हेल्थ लीडर्स नीड टू वर्क ऑन दैट, एंड रिस्पॉन्सिबल ऑर्गेनाइजेशंस जो CSR करते हैं, as we all know, CSR is with all the organizations. And I think we should, instead of run-of-the-mill camps and medicine distributions, now we should also up our game. And it should be more about awareness, bringing them to the right place, especially when most of the diseases are non-communicable lifestyle diseases. So everything, diabetes, hypertension, mental illnesses, cancers, all of them have a basis in lifestyle, जो गड़बड़ वाली lifestyle है, आचार्य जी कह रहे थे, and so the remedy also lies there. That is the first line of treatment. So I think we can do a lot, public health leaders, and I'm so happy Jagaran has taken this initiative, and this is one of the beautiful initiatives. The very fact that we are having a panel discussion here is itself out of the box thinking about health awareness.
लास्ट माइल कनेक्टिविटी की जो बात आपने कही वो वाकई में दैट इज़ वेरी इम्पैक्टफुल एंड दैट इज़ वेरी असर्टिव ऑल्सो इन द प्रेजेंट टाइम्स, क्योंकि जब तक हम लास्ट माइल कनेक्टिविटी को नहीं टारगेट करेंगे वी विल नॉट be fulfilled in the agenda which we are undertaking. This brings me to Seema, who is lead gender transform rural India. आपका जिस तरह से ताल्लुक़ रहता है रूरल इंडिया में, तो जेंडर इश्यूज़ रूरल इंडिया में एक बहुत बड़ी चुनौती, एक बहुत बड़ा चैलेंज है. ऐसे में हेल्थ केयर पॉलिसीज़ को किस तरह से हम और इंक्लूसिव बना लें कि खासकर रूरल एरियाज़ में, क्योंकि अर्बन एरियाज़ की बात तो हम करते रहते हैं, रूरल एरियाज़ में जेंडर स्पेसिफिक जो इश्यूज़ हैं उनको बेहतर तरह से एड्रेस किया जा सके.
Thank you for this opportunity to address the audience. I think that India has made a remarkable achievement in terms of various aspects. Like if you look at the life expectancy, or if you look at the mortality rates and all that, or infant mortality or maternal mortality, we have remarkable results. And we also have health and wellness centers established across the country in the nooks and corners of the country, and we have community health organizers nominated or appointed in these for outreach. Similarly, we have the National Rural Livelihood Mission program, which has SHG and its federations, a network built across the country covering 10 crore women, and also disseminating information through program which is called the Food Nutrition Health and Wash program, and that means community-based awareness program. So I think from the government side there has been a lot of inroad into very difficult areas. But even if you look at the NFHS 5 statistics, National Family Health Survey 5 statistics, we see that we have some areas, dark areas, where we need more kind of concerted attention from all departments together. One of this, of course, is the sex ratio. It has improved from NFHS 4, but we still see that the sex ratio is an area of concern, and it could be even sex-selective abortions, which is definitely due to entrenched norms of gender biases which are there in the society, and social norms which still makes us feel that the girl is a burden, and we want to get rid of her to the marital homes, and as a result of which, I don't know whether technology is still being used, but we see that the sex ratio is still adverse, and we also see that a lot of child marriages are happening. We see that presently it's like 30% is still underage children getting married. We also see dropout of children from education, girl children dropping out from education. The other major concern is that anemia for pregnant and non-pregnant women is very high, especially for non-pregnant women is going up to around 56% in the country, which is another area of concern. And I feel gendering within the families also has a role to play. So, the women would be the last or the least to eat. And even now, when we, as part of my work, when I visit the rural areas, especially in the Hindi heartland, we see that women are fasting for 100 days a year. We have been taking count, like it shows 2 to 3 days a week, amounting to almost 100 days of fasting. And for various reasons, like the welfare of the family, the welfare of the husband, for religious purposes. So when then poverty increases, we see that the consumption of the food of women is affected. And at the same time, we see that adolescents also, the taboos around adolescent diet is also, adolescent girls' diet is also extremely, gendered, because she is asked not to eat certain foods, saying that it will affect her hormonal balance, as a result of which she is deprived of all nutritious food. So that kind of awareness is lacking in the community. And another area of concern is definitely malnourishment of women for all age, up, like even including the reproductive age. And this also, we see that it's reflected with very minimum participation of women in the economic sphere. Even now, the labor force participation of women in India is around 20%, as a result of which the voice and agency of the women is still very low, as a result of which I feel that, we have plenty of policies, but the coordinated convergence of various departments, the health department, departments under the Ministry of Rural Development like National Rural Livelihood Mission and MG Narega, need to be very strongly inbuilt, so that we can reduce the gap in between system delivery and demand generation. The gap in between the community institutions and the system delivery needs to be drastically reduced, and this can happen only through concerted efforts of various departments. Thank you so much.
Seema ji, very well explained, I would say. और इससे जब when you were explaining, I remembered one very interesting advertisement. I think few years back वो एडवर्टीजमेंट रन हो रहा था, जिसमें जो इंटरनेशनल वुमेंस डे के दिन आई थिंक उसको लॉन्च किया गया था. इसमें दिखाया गया था कि महिलाओं को साड़ी नहीं चाहिए, गहने नहीं चाहिए, या रूरल एरियाज़ की भी महिलाओं को दिखाया गया था. पोषण के बारे में बात करी थी, न्यूट्रिशन के बारे में, संतरे खाते हुए, फल खाते हुए, सब्जियां खाते हुए, कि एक्चुअली में उनका गहना वो है फिजिकल वेलबींग. दिस ब्रिंग्स मी टू डॉक्टर सुनील. हेल्थ केयर पॉलिसीज़ को और इंक्लूसिव और इजीली एक्सेसिबल टू एवरीवन इन द सोसाइटी, उसके लिए क्या कुछ और कर सकते हैं डॉक्टर सुनील?
देखिए, या सी we are a country of the population, you all know that we are the most populated country in the world, populous country in the world. और बहुत आपने हिंदी में बोला, इसलिए मैं थोड़ा हिंदी में बोलने की कोशिश करता हूँ कि डिस्पैरिटीज़ बहुत है. अब अभी डॉक्टर मनीषा ने भी बताया कि सब कुछ एवरीथिंग इज़ कॉन्संट्रेटेड इन द अर्बन एरियाज, बड़े शहरों में, मेट्रो सिटीज़ में, टायर 1 सिटी, टायर 2, लेकिन रूरल एरिया, टायर 3, टायर 4 रूरल एरिया में, वहाँ पे आपको हेल्थ केयर प्रॉब्लम है, एक्सेसिबिलिटी, अफोर्डेबिलिटी. बट the government and the private healthcare institutions, they are doing their best. Everybody is doing its bit to see that the healthcare reaches to the last mile. Accessibility and affordability, ये दो मेजर इशू है. हम जब यूनिवर्सल हेल्थ कवरेज की बात करते हैं, अभी गवर्नमेंट ने भी 1.5 लाख हेल्थ एंड वेलनेस सेंटर्स क्रिएट किए हैं. So this is something amazing. I mean, Ayushman Bharat is an amazing scheme, the world's largest हेल्थ इंश्योरेंस स्कीम. सो सब अपनी तरफ से अच्छा कर रहे हैं. प्राइवेट में भी आप देखिए, टेक्नोलॉजीज़ इतनी आ गई है, बहुत एडवांसमेंट्स आ गए हैं. सो अब आयुष्मान भारत के थ्रू आप टर्शरी केयर, एक कोई बड़ी सर्जरी, मेजर सर्जरी भी आप करवा सकते हैं. सो 5 लाख तक की उनको फैसिलिटी मतलब है पर ईयर. फाइन. सो अल्टीमेटली हम इक्विटेबल हेल्थ केयर की जहाँ बात करते हैं कि सबको इक्वल केयर मिले, चाहे वेदर इज़ रिच और पुअर, irrespective of his caste, creed, social status, financial status, so he should get equitable care. तो आई थिंक अभी बहुत सारी चेंजेस आ रहे हैं पॉलिसीज़ में. ऑलरेडी नेशनल हेल्थ पॉलिसी 2017 में आई है, उसमें आप देख लीजिए सर, वेरी गुड पॉलिसी, बहुत सालों के बाद वापस आई है रिव्यू ये पॉलिसी. बट देन प्रॉब्लम यही है कि अब हाँ, जो हेल्थ की हम जब बात करते हैं कि डेफिनेशन WHO यही कहता है कि जैसे फिजिकल, मेंटल, डॉक्टर साहब ने कहा कि एंड सोशल, अभी तो स्पिरिचुअल भी हो गया, यू नो, योर हेल्थ वेल बीइंग, इट्स नॉट ओनली फिजिकल वेल बीइंग, योर मेंटल, सोशल एंड स्पिरिचुअल वेल बीइंग, सो दिस इज़ व्हाट डिफाइंस हेल्थ. तो हम इक्विटेबल, अगर हम चाहते हैं कि हम सबको इक्वल केयर मिले, तो हमें बहुत सारे सबको इन्वॉल्व करना पड़ेगा, कम्युनिटी को इन्वॉल्व करना पड़ेगा, अवेयरनेस क्रिएट करना पड़ेगा, ताकि बेसिक, जैसे बहुत सारे अभी NGOs हैं, इनको बहुत अच्छे अवार्ड्स मिले हैं जो बहुत अच्छा काम कर रहे हैं वुमेंस हेल्थ में, मेंटल हेल्थ में, inclusivity. I think this is the way, and you have taken a very good initiative. I would really appreciate to recognize those people who are doing, you know. So I think we should not look back. पहले हमारी जो ये होती थी, क्या बोलते हैं, longevity या जो हमारा लाइफ स्पेन जो हम लोग एवरेज लाइफ हमारी होती थी 35-40 साल इन 40s एंड 50s. अब हम लोग एवरेज इंडियंस की जो लाइफ स्पेन है वो 70 के आसपास है. 70 साल तक एवरेज आदमी जीता है. पहले होती थी 35 से 40 साल, क्योंकि बहुत अवेयरनेस आ गई है, साइंस ने भी बहुत तरक्की कर ली है, तो बहुत मॉडर्न फैसिलिटीज़ बहुत अवेलेबल हो गए हैं हेल्थ केयर में. तो आई थिंक हेल्थ केयर इज़ इवॉल्विंग, इट इज़ एवर इवॉल्विंग, ग्रो भी कर रहा है. पर जहाँ पे इक्विटेबल और इंक्लूसिविटी का सवाल है, उस पर काम बहुत चल रहा है. बट आई थिंक देयर इज लॉट ऑफ वर्क स्टिल नीड्स टू बी डन टू अचीव द गोल.
अवेयरनेस आई थिंक एक बहुत बड़ा गेम चेंजर है, और ओवर द ईयर्स, खासकर पिछले 10-12 सालों में अवेयरनेस ने एक बहुत कारगर एक रोल प्ले किया है. डॉक्टर निमेश, आपका जो एक्सपीरियंस है वो बहुत वास्ट है. ऐसे में एक सवाल जो आई एम श्योर एवरीवन वुड बी हैविंग ऑन देयर माइंड इज़ कि सबसे ज़्यादा जो प्रेसिंग मेंटल हेल्थ जो नीड्स हैं एक वल्नरेबल पॉपुलेशन में, आप आई एम श्योर आपका खुद वास्ता रहा होगा इन चीज़ों से, आपने ट्रीटमेंट्स किए होंगे, तो एनी ऑफ योर एक्सपीरियंसेस या ऐसी कौन सी मेंटल हेल्थ जो प्रेसिंग इश्यूज हैं यू हैव कम अक्रॉस?
थैंक्स. मैं कोशिश करूँगा अब के जो रिमार्क्स है वो हिंदी में हो. सॉरी अबाउट द लास्ट पार्ट. लेकिन हाँ, कुछ हम लोग अभी भी अनफॉर्चुनेटली इमीडिएट पोस्ट इंडिपेंडेंस इंडियंस आर टू ग्रूम्ड इन ब्रिटिश इंग्लिश ट्रेडिशन, सैडली, एंड आई कन्फेस गिल्टी टू दैट. ज्यूरी के बारे में बात कर रहे हैं 10 सेकंड में. आई होप ऑल माई कॉलीग्स विल एग्री. साइकोथेरेपी और काउंसलिंग 50-100-250 प्रकार की है, एज मोस्ट ऑफ यू विल नो. तो 70s में 80s में somebody did very extensive research on which kind of psychotherapy works, and then they found that all kind of psychotherapies and counseling have about the same effect, doesn't matter what you do. So Lubrowski and the team, they said something very, very good for psychotherapy that I think becomes very applicable to what we did on the jury, and I'm 100% sure all my colleagues will agree. Lubrowski had said, all have won and everyone must get a prize. तो कॉन्स्टेंटली पिछले 2 साल से, और ये तीसरा साल है जब मैं वहाँ बैठता हूँ वर्चुअल मीटिंग्स में, तो हमेशा मुझे ज्यूरी, बतौर ज्यूरी मेंबर वो बात याद आती है. एवरी एंट्री, एवरी नॉमिनेशन was actually deserving of the award. Like always, like Oscar, you know, and Filmfare, it's very difficult to decide. So I don't know if there are many of the nominations here, but that was about the jury. जो आपने बात कही, एक मुद्दा करूँ, that will kind of cover 2 or 3 things, and that is about dualism or dual burden. To continue further from what my 2 lady colleagues said, I don't think we have got over the infectious diseases. We still have that problem. We also have the problem of NCD. So like we have recognized in public health since the 1990s, India, South Asia, Afro-Asia actually has a dual burden of disease, even for next 2 or 3 decades. See, the Western world has now kind of taken care of the infectious diseases, and now they have to only look after the NCDs. Hamara actually dual burden of disease hai. You know, we have to continue to look after the public health and hygiene, curing infectious diseases, preventing them, and also work on the NCDs. उसका एक और एग्जाम्पल दूँ. हमारे साथी ने बात की माल नरिशमेंट की. I totally agree. Malnourishment is a serious problem. But also pause and think. Not only for urban India, but including some semi-urban areas, obesity is also an equally important problem. So we as a country, see, by now the US of A and Sweden and Norway, they don't have to worry about malnourishment. They only have to worry about the obesity epidemic. We have to worry about both. एक तरफ malnourishment है, दूसरी तरफ obesity epidemic हो रहा है. So this dualism is a problem. Communicable and non-communicable diseases, about one example, malnourishment or obesity, come to mental health. एक तरफ problem है, like obesity and malnourishment, deprivation की. So the mental health issues of the totally marginalized, और एक वाक्य में कहूँ, 20-25 साल से मैं बहुत एक्टिवली लगा हुआ हूँ इंडिविजुअली और पार्ट ऑफ टीम्स विद दी होमलेस पीपल. जो आप लोग निज़ामुद्दीन में आसफ अली रोड पे, डिलाइट सिनेमा पे, जामा मस्जिद पे देखते हैं बेघर लोग, उनके हेल्थ और मेंटल हेल्थ सर्विसेज में हम लोग 20-25 साल से कुछ साथी लगे हुए हैं. सो द डिप्राइव्ड population has one set of problems, health and mental health. The super rich have another kind of problems. You know? So we really have this two horses to ride. And that's much more of a challenge. Although I am sure that we'll meet, because again, I'll go out on a limb and say, for all 40 odd years, like it was said, long experiences. So, you know, you're kind of ancient. I recognize that. Over 40 years, I've been a proud Indian doctor and public health professional, except for brief stays outside. I really think that after the epidemic, इस महामारी के बाद हम में से किसी को भारतवर्ष में या दुनिया भर में कोई शक, कोई शुबा नहीं होना चाहिए कि इंडिया अपने डेवलपमेंट और हेल्थ चैलेंजेस इफेक्टिवली मीट करेगी. So while there is a lot of dualism, I think we will meet. Why I was going out on a limb is, मुझे सूझा, माफ कीजिएगा हमारे दोनों महिला साथी, this is not a biased claim, but मुझे ये सूझता है आज पहली बार, did we see much of a gender issue in the handling of the epidemic? I don't think so. We as a society, we as a nation, we as a country, community, I think we dealt with, it seems to me immediately as I think of it now, that we dealt with the epidemic in a fairly gender neutral manner. That is the example that we need to follow for the larger health issues. अगर हम महामारी में वो कर पाए, तो आम जीवन में क्यों नहीं कर सकते आने वाले 20-30 सालों में कि जेंडर इश्यूज ना हो, इकोनॉमिक डिटर्मिनेंट्स ना हो. अभी भी मैं सीख रहा हूँ और सीखता रहता हूँ. बहुत पहले सीखा था सोशल डिटर्मिनेंट्स ऑफ हेल्थ. नाउ आई एम लर्निंग इकोनॉमिक डिटर्मिनेंट्स ऑफ हेल्थ एंड मेंटल हेल्थ. सो कैन वी हैव अ जेंडर न्यूट्रल, as far as possible, gender neutral public health policy and implementation? That to me is the challenge, but I have no doubt that we will meet it.
डॉक्टर निमेश, आपने बहुत अच्छी तरीके से एक्सप्लेन किया कि पैंडमिक ने जिस तरह से पूरी कम्युनिटी को एक साथ ला करके खड़ा कर दिया, और कोई जेंडर स्पेसिफिक कोई अप्रोच नहीं थी इस पैंडमिक या इस महामारी को कॉम्बैट करने में. बट स्टिल लार्जर क्वेश्चन रिमेन्स कि अब हमें कैसे आगे की तैयारी करनी होगी, जितने भी जो परसिस्टिंग चैलेंजेस हैं सोसाइटी में.
2-3 वाक्य.
जी जी बिल्कुल.
माफी चाहता हूँ. आई रियली डोंट वांट टू टेक ऑन मोर टाइम. Mental health, public health, or to an extent, as a student of public policy and public health, I also try and look at mental health, health and development. And this all started, as some of you will remember, 1990 and 1993 के World Bank WHO reports on health, economy, development. विकास मंत्र है ना, आने वाले चुनाव में भी वो छोड़ देते हैं. विकास और ह्यूमन डेवलपमेंट, the previous government also had, if you all remember, Manmohan Singh ji had this motto, development with a human face. Very catchy. I don't know how much we did or did not. Regardless, 10 years of those, 10 years of this. Is development possible, especially with such a large population that we are carrying? It's not a great asset that we are the first most populous country. Is development possible without mental health and social indicators going down? It seems नहीं हो सकता. दुनिया में बहुत उदाहरण आपको कम मिलेंगे, मेरा दावा है, कि जहां विकास बहुत बढ़िया हुआ, पर कैपिटा जीडीपी इज वेरी हाई और मेंटल हेल्थ इंडिकेटर्स सब अच्छे हैं. डिवोर्स, ड्रग अब्यूज, अल्कोहलिज्म, सुसाइड. लगता ऐसे है कि विकास का एक दूसरा खामियाजा है कि आपकी मेंटल हेल्थ और सोशल इंडिकेटर्स खराब होंगे. क्या भारतवर्ष ये कर पाएगा आने वाले 20-30 साल में कि हम ऐसा न होने दें? You see, if we can retain that, value of being developed, being sensitive, and yet not going the way our big brother in the northern continent of America has done, without naming the country. That country hasn't really succeeded very well, you know, in striking this balance. Development, well-being, and health, mental health particularly.
Right. Dr. Manisha Pandey, integration of technology and innovative approaches healthcare system को और health system को, health, public health, community health को enhance करने में कितना बड़ा रोल अभी तक प्ले किया है और आने वाले समय में कितना promising आप इस integration को या इस amalgamation को देखती हैं?
I would reiterate, we are in a very happy space right now. I myself am a novice in social media usage. I keep learning from you guys. But we are in a wonderful space in the sense, in the last couple of years, there has been remarkable increase in the outreach of healthcare services just because of digital technology and the innovative methods. And as Dr. Khetrapal was saying, affordability आजकल उतना issue नहीं है thanks to government policies and so much of funding. The young guys, the Gen Z is doing so much of fundraising. अगर उनको पता भी चल जाता है, so because of social media, you get through very well. So what is the missing link? And that missing link can be compensated by the public health stalwarts, the organizations, the CSR, that missing link, taking it to the last person. So, sir, as we were talking about the affordability, I had given telemedicine services to a remote village in MP. Now, this is what I want to say. As per government's antenatal package, thyroid testing, blood group testing, everything is available. I was literally horrified to see antenatal pregnant women coming and they had to go all the way 100 kilometers in 2023-24 for delivery, for an operative delivery. The district hospital is that far. They have the resources, the package is there, but there is nobody to guide them कि सबका blood group करवाना है. And in this day and time, they have 2 live children with 8 deliveries and they are okay with that. That was the scenario in 80s when I was in medical college in 90s. So that is still happening. And the government package is already there. So what is the missing thing? It is the implementation at the grassroots level. And I think technology can play a wonderful role. Telemedicine is already doing it. We have so many wonderful apps. And वो सबके हाथ में जैसे बोलते हैं ना एक खिलौना पकड़ा दिया गया है. If you give a pen, a sharp nibbed pen to a child and don't teach him that it is meant for writing, he can use that for stabbing someone. So the same is happening with the digital, the media, the whatever we have in hands. हम जब उसमें वो videos endlessly देख रहे हैं, OTT platforms, they have plenty. So why don't we as responsible public health proponents give them matter? उसको देखने की जगह अच्छे से मैसेज वाले वीडियोस भी सर्कुलेट. वी मेक इट मैंडेटरी कि जैसे था ये स्मोकिंग इज इंजरियस फॉर हेल्थ, तो वो प्रवचन किसी को नहीं अच्छा लगता. सो वी हैव टू मेक इट इंटरेस्टिंग, मे बी गिव अ शॉट. जब ज़माना शॉर्ट का है, यूट्यूब शॉर्ट्स का, सो वाई नॉट prefix every video, every OTT thing, every shot with a message for awareness. Basically, where to reach for. Sometimes I get messages on social media and then I try to reach the helpline, it doesn't work. And sometimes it does work. So I need to know whom to approach, how to take this, and these are my rights. I think that can be wonderfully done by the use of innovative technology, the apps. Ab din bhar they have lots of fads, the diets, you all must be aware very gleefully. They will women will not go for walking because that size 0, being a woman myself, I know what my patients come across. The size 0 fad is there, so they can drink, one liquid for breakfast, one for lunch, one for dinner. They can post photos and this goes on for 2 months. But we as responsible citizens, if we tell them कि whatever you eat later is not going to work. A girl 16 to 17 needs to have enough calcium. And we make shorts, we promote it, and Jagran is doing a wonderful work here, but I think we have to intensify our efforts in this direction, use this media, use this digital platform for spreading awareness. Saman hai, awareness is necessary. So I'm very hopeful for future, and I'm really excited. So like a curious child, social media excites me, and yes, we are going to do it.
आई थिंक अवेयरनेस एंड कोलैबोरेटिव एफर्ट्स, इन दोनों चीज़ों पे आपने काफ़ी जोर दिया
Absolutely.
है, जो कि अगेन एक गेम चेंजर, क्योंकि मैंने बात भी करी थी आपसे कि अवेयरनेस एक आने वाले वक्त में गेम चेंजर पहली बात है रहा है अभी तक, आने वाले वक्त में और भी बड़ा एक रोल प्ले कर सकता है.
और ये NGOs है, and my Gen Z is very, very proactive. And they have the means, if excited enough, if involved enough. Sometimes I have an idea, probably my younger friends here, they have an idea, but they don't know whom to approach, how to go about. And this is where the corporates, the PSUs, the organizations can come into play, rope them in, and they will be the wonderful ambassadors going for the last mile connectivity.
ट्रू. सीमा, कमिंग टू यू, आपने ग्रास रूट लेवल पे बहुत सारे काम किए हैं और आई एम श्योर ट्राइबल कम्युनिटीज़ के साथ भी आपने बहुत अच्छी तरह से कनेक्ट किया होगा, उनके इश्यूज भी समझे होंगे. ऐसे में हेल्थ केयर जो पूरा सिस्टम है ओवर द लास्ट सो मेनी ईयर्स, मैं आपके एक्सपीरियंस की बात करूँगी, किस तरह के चेंजेस, आई एम श्योर एक पैराडाइम शिफ्ट तो हुआ है, किस तरह के चेंजेस आपके पर्सनल एक्सपीरियंस में रहे हैं इस सेक्टर में?
So I'll just begin with responding to what Doctor had stopped with. Of course, pandemic showed us that the healthcare facility and the outreach was extremely equitable in terms of the vaccination, and the country has done an admirable job being able to cross over the pandemic. But at the same time, and I think we are greatly indebted to the ASHAs and to the SHG Federation women who have played a very, crucial role in reaching out and having a last mile delivery. If not for the ASHAs, I think many of us would not be alive today. So I take this opportunity to, express that indebtedness. At the same time, we see when we look at the SHG data, all the accounts of women which they had saved was completely utilized because of exigencies. And, women were drastically impacted upon because SSG Federation, there's been a huge saving because they have credit linkages, they have, access to various kinds of funds, but they had to use their funds for the exigencies, and as because of unemployment, large exodus of migrants back to their native states, and this really impacted on the poverty levels or the impoverishment of women. So that is one aspect. Secondly, we see that there was an outburst of the shadow pandemic, which is domestic violence. Even now, NFHS 5 talks about domestic violence, which is a public health issue. It's not just a personal issue, it's a public health issue. And during the pandemic, it was like the shadow pandemic, which we have not yet controlled over. We could bring about behavioral changes, we could change social norms. We have achieved, amazingly and actually changed the history, but we have not done anything as far as the shadow pandemic is concerned. And women still suffer in the silence of the home. So this is one thing which I would like to point out. Second is, of course, there's been great achievement in the tribal area in terms of under 5 mortality, in terms of infant mortality, in terms of maternal mortality. Programs are reaching, the health and wellness centers are there, the CHOs are there, the ASHAs are there, there is the Janani Janma Suraksha Yojana, there is an ambulance facility, all that is reaching. So the challenge, but as even now the challenge lies in quality of healthcare services. Because in the very remote and marginalized areas, quality of healthcare services is still a constraint. Sometimes there's lack of availability of medicine, sometimes of infrastructural facilities, sometimes a lack of examination facilities. So what happens? Blood testing and examination facilities, as a result of which timely recovery and timely assessment or diagnosis does not happen. Similarly, in case of labor room facilities, the quality in the labor rooms, the kind of confidentiality which there should be there in the labor rooms, the apathy of the doctors and lack of doctors going to remote areas and understaffing of medical personnel in the remote areas is also a hindrance. So maybe we need to work towards creation of more committed professionals or young personnel who would like to really work in remote areas and bring about changes. And at the same time also build on awareness of the community to be able to seek, the services in time. So these are some of the ideas which I would like to throw up.
Thank you so much, Seema. And it was lovely to have you all here for this very wonderful panel discussion. I'm sure, as usual, जो बाकी भी हमारे panel discussions थे उन्हीं की तरह, there were a lot of takeaways from the eminent jurors who joined us for this deliberation. Our heartfelt gratitude to each and every one of you.